Hi there, I'm Dr. Michael Hibner, the founder, provider, and surgeon at the Arizona Center for Chronic Pelvic Pain. Welcome back to Questions That Need Answers with Dr. Michael Hibner, a YouTube channel I created to help you with your questions about chronic pelvic pain. I have been away for a few months, busy with the move of our office to a new location at 9440 East Ironwood Square Drive in beautiful Scottsdale, Arizona. Now that the office is up and running, I will be producing more episodes where I'll answer your questions and share interesting stories of challenging patients. Some of them may sound like the condition you're dealing with, and hopefully their journey can inspire you on your own path to recovery. The Arizona Center for Chronic Pelvic Pain was founded by me in 2004, and for 16 years we were located at St. Joseph's Hospital and Medical Center in Phoenix, but in 2020 I have moved my practice to Scottsdale. Over the years, I have helped countless women and men with chronic pelvic pain, pudendal neuralgia, pudendal and other pelvic nerve entrapment syndromes, spastic pelvic floor, pelvic mesh injuries, severe endometriosis, interstitial cystitis, pelvic congestion, and many other conditions leading to pelvic pain. We are one of the few practices worldwide that treats pain caused by pudendal nerve entrapment, and I am one of the handful surgeons who performs pudendal nerve decompression surgery. I also specialize in pain which developed after placement of pelvic mesh. In fact, I'm the only surgeon in the United States who is trained and board certified in urogynecology, a specialty involved with treatment of urinary incontinence and pelvic prolapse in women, who also performs pelvic nerve decompression surgeries. This gives me the unique knowledge to treat patients who have developed neuropathic pelvic pain after placement of pelvic mesh. Another condition that I treat is endometriosis. It can cause severe pelvic pain and disability, and it is often found in young women. It can significantly affect their quality of life, ability to have sex, and sometimes even their chances of getting pregnant. The pain from endometriosis isn't just caused by the disease itself, but also by other conditions like irritable bowel syndrome, painful bladder syndrome, and spasms in the pelvic floor muscles. In fact, I wrote a book chapter called The Evil Quadruplets about these conditions that often go hand in hand with endometriosis. When treating endometriosis, it is important not only to remove the disease, but also to address other conditions that can be more painful than endometriosis itself. And when operating on patients with endometriosis, it is crucial to remove the disease completely, including any implants on the bowel, bladder, diaphragm, and other areas. I perform endometriosis resection surgeries using the Da Vinci surgical robot, which I learned during my fellowship at the Mayo Clinic back in 2001. At that time, it was one of the first places where the robotic surgery was done. Over the years, I have performed thousands of robotic surgeries while teaching numerous residents, fellows, and other physicians. In fact, in 2006, I performed more robotic surgeries than any other surgeon in the United States. For all these accomplishments, last year I was elected the next president of AAGL, the American Academy of Gynecologic Laparoscopists, the largest gynecologic surgical societies in the world. And just a quick reminder, the videos on this channel are for informational purposes only. They don't replace medical advice from a qualified provider. That's because a doctor can only give you a proper advice after getting to know you and evaluating your personal specific condition. So if someone that you know is dealing with chronic pelvic pain, I highly recommend visiting our website at azccpp.com. There you can learn more about our practice and make an appointment. Feel free to give us a call at 480-599-9682 or send us an email at clinic@azccpp.com. Remember, your pelvic pain is real. It is not in your head. Don't go through this alone. We're here to help.